Good morning to you, and thank you so much for joining us here on NTV. In this 11 o'clock hour, we are going to be having a talk show that's going to be centered on increasing awareness and also financing for the immunization against cervical cancer and childhood illnesses. Now, this talk show is brought to you by Impact as well as the Ministry of Health. My name is Priscilla Regina Naluoga, and you are most welcome. Now, I would like to first introduce our discussants for this particular topic this morning, who are going to help us dive deeper into immunization and financing. Now, we do have head of programs from Impact, and that is Mr. Alvin Muhwezi. You're most welcome.
Thank you, Priscilla. Good morning, viewers, and I'm happy to be here. Thank you.
Okay, and then next to him we do have Principal Nursing Officer all the way from the Ministry of Health, and that is Sister Emily Cheptoyek.
Good morning, viewers. This is Emily Cheptoyek. Nice to be here.
Okay, all right, and of course our final discussant on this subject is the one and only Honorable Dr. Nicholas Kamara from Kabale Municipality. You're most welcome, Honorable.
Yeah, thank you so much, Priscilla, and good morning, viewers.
Okay, all right, looking at increasing awareness and financing for the immunization against cancer, and that is cervical cancer as well as childhood illnesses. Immunization, Mr. Muhwezi, is actually very paramount, especially the HPV vaccination in the medical area. How come the civil society is actually leading this promotion?
Well, like you've rightly put it, it's very important, and as civil society, we feel our contribution is to support the Ministry of Health and other stakeholders in accelerating two things. One, vaccine access to the ordinary Ugandan of whatever age and dispensation, but also two, to continuously advocate for increased resource mobilization for vaccination and immunization services. You will notice, for example, that we are currently heavily donor dependent. About 95% or thereabouts of our immunization and vaccine budget is from donors, including Gavi, and a smaller percentage comes from the government. So issues of sustainability around that, prioritization, need to continuously be pushed for, and by engaging stakeholders led by the legislature and my MP colleague here, is one of the things that we as civil society are also pushing for. So advocacy, awareness, and access to vaccination and immunization services.
Okay, all right. So you're the helping hand to the Ministry of Health.
Indeed.
Turning to you, Sister Emily, why are we having such increased cases of cancer here in Uganda, especially in light of the fact that, according to the Ministry of Health, we seem to be taking steps in the right direction to actually avert cancers?
Well, I wouldn't say that there is an increase or no, just because, you know, cancer, in the past, the awareness was not so much. But with the increasing awareness, people are more informed and diagnosis is earlier. So there seems to be a trend that is showing an increase in the cancers. However, of course, there is no clear documentation to show that we really didn't have it in the past. But with the increased awareness, we are now seeing that we are able to recognize that cancer has increased.
Okay, all right. Turning to the Honorable Member of Parliament, with the people that you've been engaging with and also service delivery to the people. In Kabale, do you feel that people actually have received their awareness and later on actually picked up the mandate to go for diagnosis as far as cancer is concerned?
Yeah, thank you so much. And I will apologize for being a Member of Parliament and a doctor at the same time. I will be playing both roles. And there is a forum I lead called the Parliamentary Forum on Non-Communicable Diseases. And as you know, cancer is a non-communicable disease. Really, when you see much of the service delivery that we have in health today, it goes to like 5 diseases. That is HIV, TB, malaria, and some other infectious diseases, maybe childhood diseases and maternal child health. When it comes to non-communicable diseases, the awareness and the money and resources that are put there are just a tip of the iceberg of the problem we have. You know that non-communicable diseases account for like 30% of the deaths after the age of 30. But when you reach at the grassroots, you find that there are not enough resources, there is not enough health workforce, there are not enough drugs, and the services that are offered at the grassroots are not what we expect. For example, there is no screening. Screening at health center 3 is very minimal. For cancer of cervix, maybe, but for other cancers, it is minimal. When we talk about health education, most of the health education is in these diseases that I've talked about. When it comes to the treatment, you know, the biggest treatment center in Uganda is Uganda Cancer Institute. Even at the regional referral hospitals, you don't find a lot of services at regional referral hospitals for non-communicable diseases. So in short, for us as a forum, parliamentary forum on non-communicable diseases, we are calling for more awareness, for more resources to be put in this area, and for more workforce, and for people to be more involved. And I've always argued that once we have enough resources, we shall not need to reinvent the wheel. The systems have been created by TB. There is by the way, there is a TB district focal person. There is HIV district focal person. There is a focal person for all other things, maternal child health. But you never see a focal person for cancer. You never see a focal person for non-communicable diseases. But for the cancer of cervix, I think we have tried. And we have an opportunity because this is immunizable. It is caused by, most of the cancer of the cervix is caused by human papilloma virus. Now human papilloma virus is immunizable. You can immunize against human papilloma virus. So this is our chance for non-communicable diseases. We have almost only 2 diseases which you can immunize against. That is hepatitis B and cancer of the cervix. So there is a big opportunity for us to get vaccination against this cancer. Okay. I can say without any doubt that the vaccines for human papilloma virus, which prevent cancer of the cervix, are already in our health centers. But the problem is that I think, sister will talk about it now, I go back to my niche of being a member of parliament. But what I have heard from the grassroots, that many people are taking up the first dose, but the second dose, we are still doing poorly. But I want to really thank the people who have given us the vaccine. It is there, and it is one of the areas, few areas where we have a chance to prevent one of the types of the cancer, which is cancer of the cervix.
Before we come back to the vaccine, because, for example, take a case study of COVID-19. The disease was there, the vaccines were there, probably enough to take through first phase or the first dose. But the big question is, are they available or easily accessible for the second dose? That's a question. I'm coming back to you. But back to you, Member of Parliament. In regards to childhood illnesses, what has been your advocacy work towards that in particular also?
Yeah, you see, Ministry of Health has really done quite well in childhood illnesses, especially in areas of vaccination. We are doing quite well, but the problem now is that we used to have 6 immunizable diseases, but now we have 14. So it increases the workload of health workers and increases the way everyone records what, but at least the vaccines are there. And people picking it. But see, health is not only about vaccines. The pillars of a health system are like 6. There is a human resource, there are medicines, there is governance, and so on and so forth. So for us, in Parliament, we advocate for more funding. And one of the ways we have advocated is through the Committee of Health, where I belong. But at the same time, we also advocate through our fora. One of the fora where we have advocated is the Parliamentary Forum on Immunization, which has been able to increase the budget of immunization. At the same time, we made the rule of, we made the law of the Immunization Act. It was repealed and, of course, put together with the Public Health Act.
Yes.
But it is there. So that is our role, to appropriate and increase the budget. At the same time, make appropriate laws and policies for the country.
So it's governance and financing.
Yeah.
Let's come back to the medicine side of it. Sister Emily, when you look at the cancer of the cervix, it's one of the leading challenges or causes of morbidity and mortality, especially for women. What are the root causes of this particular cancer?
Yeah, first of all, we have to appreciate that cancer generally, the cause is not known. However, for cervical cancer, it is linked to the human papilloma virus, which is transmitted sexually through sexual intercourse. So the woman gets it by indulging in sex, and especially with multiple sexual partners, the woman gets more exposure, and there are several strains of the HPV or human papilloma virus. However, the 16 and 17 are the major causes of the cervical cancer. That's why women get the cervical cancer. Yes.
Okay, all right. Mr. Muhwezi, in terms of civil society, what have you found to be the major challenges as far as the HPV vaccination drive is concerned?
I think there are three major challenges. The first one is vaccine hesitancy. Because we notice a lot of so this vaccine is suited for a girl 10 years. Why 10 years? Because based on several studies of the Ugandan social culture, we believe that at least at 10 years a girl has not yet started being sexually active. But the primary premise is that she should not have had any sexual encounter. Now, this has to be consented by a parent or guardian. And that's where the opportunity for what we call myth peddlers comes in. People who go around peddling all kinds of myths and misconceptions about vaccines. They will, I don't want to promote what they say, but they will discourage parents from having their girls vaccinated. So that is one. However, we've quickly linked that to lack of awareness and adequate knowledge. And so our role as civil society has really been to address it from that point. Let us engage all stakeholders at all levels. And I must say, once we have engaged and sensitized and interacted with these stakeholders, we've gotten a very positive response. I like giving the example of RDCs, resident district commissioners, and members of parliament, for example, where we have seen them cede the airtime that they have on different media platforms to us and say, no, come, let's go together. I have this slot. I will use the opportunity to sensitize my colleagues about this. And interestingly, they will concede that they also did not know some of the things that we are informing them about, the benefits of the vaccine, what it protects the girl child against, and how easy it is accessible in the health facilities. And again, just to add to what the Honorable said, we have to commend the Ministry of Health, because when it comes to vaccines being on ground for HPV, human papilloma virus, indeed they are the health facilities. So that sort of tags to the second challenge. And the third challenge we are encountering is that most of the immunization or vaccination efforts for human papilloma virus are concentrated in the integrated child health day months of April and October. So that's when most initiatives are pushed by health workers to vaccinate against the human papilloma virus. Yet what we know is that it should be a routine vaccination like any other of the 14 immunizable diseases. So that again is what we are working with the health workers through the Ministry of Health to make sure that it is routinely given to the girls at the health facilities.
Okay.
Yes.
All right, so a picture has come to my mind. Someone is seeking information, and it being stated that cervical cancer is really as a result of sexual intercourse. It begs the question, and I trust that you have interacted with or faced this question so many times, Mr. Muhwezi, that what is the remedy for the side of the men so as not to transmit the HPV virus?
Yes. For the men, absolutely, it goes back to the standard messages that we are giving around sexual relationships, safe, protected, and in this case, really, if you are talking about minors, outrightly illegal and against the law. But we are also emphasizing that men are carriers of the human papillomavirus. We know some countries, I think Australia being one of them, that are also pushing for vaccination for the boy child or the boys. I think my colleagues at the ministry have more information on how far we've gone. I know those discussions are also happening here. And that's why we are also intentional not only about engaging with parents and guardians, but the wider community.
Okay.
For example, when we are advocating for community uptake of the vaccine, we also work with schools. So that the message goes out that cervical cancer affects everyone. It's not only that it may physically affect the girl child, but it also has an impact on the boy.
Okay.
Yes.
And from where you've been able to conduct these awareness drives and vaccination drives, which are the high-risk areas for us as a country?
In terms of geography,
Yes,
or in terms of geography, it's sporadic. So you'll hear there is an increase, a decline in vaccine uptake in one community, and then after another assessment in another. But what is constant overall is that second dose uptake across Uganda is very low. So you look at, for example, in 2016, we had about 66% of the targeted girls getting first dose. Only 4% got second dose.
What's the range between the first dose and the second dose?
6 months.
6 months.
Yes.
Why does it have to be the case that after 6 months, even if I'm pretty sure you have the information, the contact information, they have cards that of course they have to be with in order to come back for the second dose. So what has failed that?
There are two reasons. One is that there has been some challenges around records management. Okay. So for example, with for the communities we've gone through, you find someone got the vaccine at school but maybe didn't get the card, and so is not able to know when the 6 months are due, and so forth. The other challenge is just like we saw with COVID. Somehow the perception that one shot will do, the second shot is for nyongeza, so to speak, or an extra booster. And then when, like in COVID, you add booster, you then see that even for the booster shot, the uptake is lower. So again, it's a perception thing, and it's a continuous engagement around behavior change. We know some people even ask, why isn't there a single dose? But I think those are discussions again, like for the male vaccine that are ongoing. But generally it's a mindset issue and a behavior change issue, and it's not that it can't be fixed, it can, but it requires continuous engagement, like we are trying to do now, sensitizing communities.
All right, Sister Emily, let's first look at the boy child. At the end of the day, no matter how much awareness advocacy work is done, no matter how many girls go for this immunization, it will not stop other cases coming up because of how it is transmitted. And so it begs the question, how do we mitigate on both sides to end cervical cancer, which means that the boy child also has to be considered in this dialogue of treatments. And here, Mr. Muhwezi having informed us that there are ongoing discussions about maybe also finding a remedy that helps the boy child and that HPV virus being under control. What's the direction? What's the engagement stage right now?
Well, like Alvin mentioned, the boy child is a carrier. There are several strains of the HPV virus that they carry. However, the priority fixed on the girl child is because of the severity of the cervical cancer it causes on the woman. For the boy child, it causes, yes, some infections, the viral warts here and there. However, there was need due to the...
Just before we continue, so that takes away the question of, do men get cervical cancer?
They
simply carriers.
They don't have a cervix.
Yeah. Okay.
However, they get some other forms of infections from the HPV, which is the viral warts, which can be treated and manageable. So the biggest risk is in the girl. And zeroing back to the financing, of course, we have support from Ministry of from the government, which funds the vaccination activities. However, it's not enough to make us broaden up to the boy child as well. So there is need for prioritization, and that's how it was zeroed, that the girl child who has not yet indulged in sexual intercourse could be vaccinated to prevent, you know, the cases of cervical cancer. But I believe with the ongoing discussions and probably with the more financing from the advocacy that is happening now, eventually probably the boy child will also be brought on board.
All right. As a ministry, check a case of what's currently happening with the under-15s under policy. Will be allowed to take, you know, birth control methods of their choice, or especially the pill. That's the talk that is on right now. Now, when you're talking about these young ladies also, by policy, is there a way as a ministry you can also ensure that people understand it from that perspective, and you offer that, for lack of a better word, iron hand to aid in fighting against this cancer?
Are we relating it to the contraceptive?
Yes, please.
What I would say is, for the contraception, I wouldn't say much about that yet. Yes, it is still in
discussion.
I think under discussion,
yes.
And I wouldn't really say anything much about that. However, for the cervical cancer, the HPV vaccine has been with us since 2015. It was introduced in 2015, and indeed it started with a pilot. Eventually, it was cascaded, and if there are any studies conducted, it may have reduced the incidences of cervical cancer from those girls who were vaccinated. However, like he mentioned, we have a gap with completing the dose from first dose to second dose. At times, we had attributed it to the range. 6 months is quite long for a young girl to kind of remember. And also the fact that the little resource that we have and the few human resources in the facilities cannot allow for easy access for these services, in that they cannot have outreaches to look for these girls in the schools, look for them in the communities, to also remind that you are due for the next dose. So we also attribute that to the low second dose coverage, and also the data challenges. If a girl cannot keep a card, or if they shift from one school to the other and left the card in another school, it's hard for the health worker to tell if this girl is actually getting the second dose or the first dose. So most times it is documented as the first dose. However, it does not take away the fact that there is low second dose, uptake generally, and that's the need for awareness, promotion, and also we encourage our health workers to really health educate as they give this vaccine, inform the teachers, even to cause reminders for us to go back to the school or to the community to give this second dose.
What's the age group that we're looking at here? Mr. Mkwezi, you said 10.
10.
10. So we're looking to 10
12.
to...
There are a few exceptions for 12.
Yes,
but
the range is between 9 and 13 years
9
as
and
per the
13 years.
WHO guidance. However, as a country, we also needed to come up with an average age on which to base, even to quantify the needs that we need for this vaccine.
Okay.
So Uganda zeroed for 10-year-old girl with the perception that they have not yet been indulged in the sexual activity.
Okay.
However, we also go ahead to give up to 12 to 13 years for those who missed with these misses of access and the delayed second dose. We tend to extend to that period, and that is why in the period of Integrated Child Health Days, which is October now, we do a catch-up. Call upon everybody who ever received a dose, please come and complete your schedule.
All right. Dr. Kamara, in this regard, I'm reminded of my school days around that age bracket into my teenage years. Tetanus was part of the curriculum. We would get tetanus shots, you get your card, and then somehow the school nursing administration would follow up on the card, and the records, as Mr. Muhwezi was saying, were kept very well for us to be able to get the other doses that they are followed thereafter. That even when I was out of the school system, I knew that if I'm going to go for a tetanus shot, I have to remember when I last I had to keep that card very well so that it's appropriate for my next shot even out of high school. Following that program, from where I'm seated, I trust that it was quite successful. So this is an age group whereby we can have partnerships, engagements with other stakeholders to aid drive awareness, and then later on, of course, push for the vaccination. In that regard, what's your perspective? And as a parliamentary committee, have you had any related discussion to that?
I can't say. Of course, we one of the reasons we interact with the civil society organization is to make sure that we get a lot of information. Not all people who come to Parliament know that they are even immunizable diseases. Some of us are just lucky, but I don't know much about engineering. I don't know much about education, maybe from what I read. So members of Parliament come from diverse backgrounds. So civil society organization comes in to, first of all, give us information and also sensitize us as members of Parliament, and also give us tips on how to do a lot of advocacy and awareness. So that is how civil society comes in. Having said that, as members of Parliament, again, our role is to represent our people. And one of the ways we can represent our people is to make sure that the services, they get the services they're supposed to be getting. Now, in my view, probably not discussed at the parliamentary health committee level, there are always around 8 million people, 8 million students in primary school at any one time. So it means that if you multiply by 7, how many students have passed through primary schools? UP has increased the uptake of education at primary level. So to me, building from what you have been saying, I think this is something that we have not used properly. The primary school the primary school going students are a low-hanging fruit. And I usually argue that we have not used it very well. It is a group which is there in classroom, organized, structured, under some sort of administration. You just say, let us go to all primary schools in Uganda, and you have covered 8 million in a flash. Exactly. Of course, not all, but you see the class, each class will be coming in. Maybe you cover 2 or 3, but imagine if we multiply that by 7 years. Those are many people. That's a lot of people you have covered.
Yeah, you've covered about 49 million.
Yeah, so I think for me it is good enough. Let us use everyone. For us, we shall do our part, increase funding. Civil society organization also do their part in advocacy.
On that part of financing,
does their part.
When you say you'll do your part to increase financing, where is that money going to be coming from? Are we going to be, asking for donations. For example, take the case of the current financial year budget cuts. We are preparing for AFCON, among other things, so I'm pretty sure there's going to be budget cuts to other ministries.
Yeah, definitely. Resources are always limited.
Government.
And health financing, if you can go to the health financing of Uganda today, like government funds like 30%. Government funds like 30% of health. Donors fund like 40%, and then the other 30% or more comes from out of pocket. It is out of pocket expenditure. So you can see the government fund is actually very little for health. They do a lot, but if you ask where they get the vaccines, probably these are donations. But of course, they will pay salaries for the people are giving the what? The vaccinations. Now, one of the ways we intend to improve the financing in health is by bringing up the National Health Insurance Scheme. However, we do not have an enabling law at present, and we have been pushing that the National Health Insurance Scheme Act, which will come as a bill, be brought to Parliament so that we can think about it, talk about it, and at least improve. Many countries have done it. Tanzania, where the people first bring this idea, we even had the whole department in the Ministry of Health for health financing. We brought the idea before Rwanda. We brought the idea before Kenya. Recently, as health committee in Ethiopia, we are health insurance covers like only 1%. Some countries like Rwanda are 90%. So it is an emergency that we pass this national health insurance. We bring this national health insurance bill to Parliament, discuss it, and pass it as quickly as possible. That one, we hope, it will not solve all the financing problems, but at least to improve some, to increase some few finances in the health system, and probably we improve the financing of immunization and my diseases, non-communicable diseases, which I advocate for almost every day of my life.
Okay. Yeah. Speaking of advocacy, how are you rallying other members of Parliament? Because there's an upsurge in other diseases, especially children illnesses, upsurge in polio. You are having upsurge in measles. We've seen those cases recently in the last 2 years. Cases have gone high. So how are you helping other members of Parliament to, advocate, to go back to their constituencies and push the people to actually take up these initiatives of vaccination?
Yeah, so as I said, we have like 3 areas where we really inform our members of Parliament. The first one is when we interact with people who give us information, like Ministry of Health, civil society organizations outside Parliament, and also, of course, refine us in how to advocate for this issue. The way you advocate for immunization is not the same way you advocate for family planning, and it's not the same way you advocate for water. So these people refine us. Secondly, we have also our small civil society organizations, which are called the parliamentary fora. For example, we have a parliamentary forum on immunization, and it has done a great job. And these are the members who really believe that immunization is too important, that they must add it on their other roles. So they become advocates. When they become advocates, now they rally other members of Parliament behind them, and then we almost all of us end up becoming advocates. So that is number 2. Number 3, definitely it is through our committees. Through the Committee of Education, through the Committee on Health, through the Committee of Gender. These are the things we discuss. And many times we interact with the civil society organizations, ministries. We ask them how far is immunization. And of course, finally, representation. Once now we get the gospel of immunization, we go back. For us, we are always in parties. We are always in occasions as a guest. So if you have something to say, to talk.
Yeah.
When you start talking, you are likely to talk about something where you were sensitized. Something you don't know, you know nothing about, You are not going to talk about it.
Speaking of knowing something, Sister Emily, I also know that, for example, children, for example, babies, I know that there's quite a sequence of immunization they're supposed to be going through. And also, uptake of that immunization seems to be challenged in most recent times, especially coming back for the second doses and the other doses, depending on which, disease of the 14 now killer diseases that you're trying to remedy. How are you as a ministry actually reverting that?
Well, just like Honorable mentioned, there are more vaccines in our schedule now, from the 6 vaccines or the 6 killer diseases to now 14. What we usually encourage is, first of all, we create awareness through the CSOs, like Impact and Path support us a lot, and also the parliamentary fora, they support us to advocate and create more awareness out there for people to seek vaccination services. We have...
and of course, through your health workers also.
Yes, yes. And we have endeavored as Ministry of Health to equip the health worker with the knowledge and skill to pass on to the rest. And also another strategy that Ministry of Health has come up with, like I said, much as there is financing from government, which Honorable has elaborated on, it's not enough to allow for access. And for us to increase access means we have to open our health facilities Monday to Friday. That immunization section has to run from Monday to Friday. And given the low human resource, you find that some places apportion days for those services, so it limits the access. Secondly, for us to increase access is to allow or facilitate the health worker reach out to an outreach post or to a school, so that we are able to catch these numbers who are unable to reach us at the service points. So with that limitation, what the Ministry of Health came up with was a strategy of having periods of mop-up, integrated child health days, and this they designated April and October as months where we encourage, where all stakeholders come in, the CSOs, the MPs, increased awareness, increased social mobilization, and also it comes along with a bigger resource, financial resource, to facilitate the health workers now go out to look for these target groups, the children who missed, those who were due for their doses but haven't yet received. So it is a period for mop-up. So we catch up, and the intention of Ministry of Health is to bring everybody now to par, to have received all their doses, their due doses, and then we start. And in that period, there is a lot of awareness creation. But the challenge we normally get in that period is, especially in the urban settings. Incidentally, the urban area tends to be gated a lot. Gated homes. It's hard to access those gated homes. And as, with the myths and so a lot of communication, social media myths that are moving around, also parents are drawn away by all these social media rumors against vaccination. So
and
it
the
affects,
misinformation
and the misinformation. It affects
Fake
services, especially in the urban settings.
All right. Mr.
So
Mwezi.
just to add on, before I close, just to add on what Honorable mentioned about finding the target, probably not only for HPV, but also for the TD. You mentioned something very key. The TD vaccination for the girl child, or for the girls 15 to 49 years, has been very low. Incidentally, we catch the numbers in ANC, antenatal care, just by default, because the mother has gone for checkup anyway, and one of the packages is vaccination for tetanus diphtheria. However, the school health reaching out to this girl who is mainly in secondary school. Already we have limited resource to make us reach the primary school, but yet we have a bigger coverage even to reach what? The secondary school, where we catch the TD girls.
All right.
So, yes.
Mr. Muhwezi, as civil society, what can be done? Because the population is increasing rapidly. That means that the gap of awareness is also increasing, like it or not. And so as civil society, what can you do about the reality of the matter is that some children are not even receiving vaccinations. Some parents are not even thinking of taking their children for these vaccinations.
Well, fortunately for civil society, what we have now is we have developed a critical mass of experts in areas around behavior change communication. And this means we are now able to custom fit information for different cohorts. In the past, one of the most common mistakes we used to make was to have one message for all. And that really has proven not to be very effective. So what we've done is we've customized our messaging and our interventions for different cohorts. Secondly, which we are doing right now as we speak, is leveraging on existing initiatives. So like the Integrated Child Health Days campaigns that are pushed by the Ministry of Health in April and October is a very convenient opportunity for us to also ramp up our awareness raising, so that we complement what they are doing, because now we know the focus is on the child, it's on vaccination. HPV is a vaccine suited for, HPV vaccine is suited for a child. And so if we leverage that initiative, we are able to reach more people with information and then immediately link them to a service. The third thing we have really invested in is appreciating that we cannot just sit and lament about lack of this, lack of that. We have to appreciate that these decisions are made through a structured forum, and it is the legislature that leads in prioritization and resource allocation, and so we need to be intentional about engaging them. And we've been doing that quite deliberately of late. We have been very active with the Uganda Parliamentary Forum on immunization, and like the Honorable said, they are a very receptive group. They really would want you to give them information. I know that one of the challenges we faced in the past was how to package our information, our ask. We would sort of just go and say, we want this, and then they say, no, you need to give us, you need to understand that there are discussions on context.
Especially in a time where data-driven decisions need to be made.
Yes, so we have improved tremendously in that space, and that's why you see there is increased budget allocation to areas that we are really pushing for, including vaccination. But like you've rightly said, the population is growing, meaning the challenge is still prevalent, and we need to invest a lot of time in continuing to find creative ways, practical ways, sustainable ways to achieve our targets. I talked earlier about the RDCs ceding their media time to us to sensitize communities. But some have even said, why don't you integrate this message with programs that government is really invested in the moment, like the parish development model. So we've had government officials, district officials say, I'm going for a parish development model activity. Can you come along and talk about the HPV vaccine and its benefits? Because it is the parents who are being talked to about investing in the parish development model and the benefits, and it's the same parents who give consent for their child to be immunized. So why not use that platform? So again, there are steps being made, and we continue to share. I think even in the past, the conversations used to be a little bit more confrontational. We need this, you're not doing enough.
We're helping you up your role.
But now we
become active.
Yes, now when Honorable comes in and says we actually invite civil society to us to give us information, it's testimony to how we are now more cooperative and working as a team, and I think that has helped us succeed. Just to end on that point, I was looking at the figures for last year for HPV, and we actually, meaning as a team, exceeded the target. We achieved 167% for the first dose. But again, second dose is only 66%. Yes.
Okay.
So while we moved tremendously, from 4% and 66% in 2016, meaning we didn't even hit the target for first dose. We exceeded the target for first dose, but still we score low on second dose.
Speaking of the cancer of the cervix, Sister Emily, there's the looming question. While you're saying the focal point is ages between 9 and 13, for Uganda being 10 specifically, it lingers the bigger question, why is it it's the women getting the cervical cancer at the end of the day? In the hospitals, it is adults who are being diagnosed with cervical cancer.
Yeah, first we need to appreciate that cervical cancer is a disease of secrecy, given the fact that it attacks the private parts. And it takes quite long for someone to know that they have actually developed what? Cervical cancer. For them to even say that they have an abnormal discharge or probably what comes with cervical cancer, it takes quite long. And for someone to know that they actually have cancer is from the routine checks. First, we are preventing this girl from getting cervical cancer, but if this person is already sexually active, a woman like I, the only way I can best protect myself is to arrest it early, in early stages, go for screening, which is every 3 years, and even for some other, there are some cases where we encourage people to go for annual screening for cervical cancer so that it can be arrested early enough. Like I said, it's a disease of secrecy. It's hard. By the time a woman comes up, it is too late. And most times, that's why you see the numbers are big in the adult women, because we discover, it is discovered when it is late to arrest or to even reverse the symptoms.
Okay, all right. Dr. Kamara, in this regard, the mandate is quite clear that we want every girl child 10 to 13 years of age to be immunized against the cancer of cervix. How is the Parliamentary Committee on Immunization fronting this agenda?
Yeah, the agenda, as I said, this is an advocacy team, advocacy group in Parliament, Parliamentary Forum on Immunization, which is already very motivated, because by the mere fact, no one forces you to be in any forum. This is not by invitation. This one, you take yourself there and you say, I want to be a member of this forum because I believe that this is very important. So people are already motivated. But we need now to motivate as many members of Parliament as possible, so that they can be giving out the same messages. First of all, in their committees. You know, now we are starting a budgeting cycle. Soon, the ministerial policy statements are coming. Soon, then we shall go to budget framework paper. If it doesn't find if the budget does not find itself there of immunization around the ministerial policy statement and budget framework paper, and find the budget, you will never get the money. Secondly, people must now, because there are some times when you have child days, ministers come and give information. Like recently, it was a day of the girl child. Now the minister comes and gives a statement in Parliament. Now, this can be a good chance when members of Parliament have been sensitized, they come up and say, the uptake of second dose is low, what can we do? Shall we increase the money so that people can go for outreaches? Can we increase on the human resource? But at the same time, in conclusion, really, I think we need more coordination. If we're coordinating all our ministries and departments and systems, some of these things, you see, the education is doing its own. They think they're just supposed to be teaching. Meanwhile,
but independence instead of interdependence.
Meanwhile, when I'm teaching about NCDs, these people are packing juice, they are packing cakes. They think taking their children in cars and bringing them back is in the vogue, and then the children are becoming obese. There is almost a dearth of health education at the school level. They think for them their role is just to be teaching. But if we included in the curriculum a small part of health education at school level, and also the school nurse is also doing part of our job to say that, are you vaccinated? They tick. Then also the health workers do their part. Ministry of Gender, also they do their part. But we are coordinated, and we don't we don't feel as if for us we are doing just linear education, then health. If you are doing health, don't talk about gender issues. If you are doing gender, don't do health.
Okay.
So I think coordination is very important, but
So
at the same
advocacy,
time, a good health practice.
health, vaccination, but coordination is
Yeah,
why
I think
we're all in
coordination
this
is
room.
very important,
Yes,
and we will talk about
and,
this
and
all.
Honorable, I pray that in your coordination conversation,
Yeah.
you're also, you know, cognizant of the fact that even religious leaders and cultural leaders can
That's
play
true.
a very, very pivotal
Very,
role
very
in
big
this,
role, yeah.
in this dialogue.
Yeah.
Sister Emily, your closing remarks to our population. The reality is before us that our 10-year-olds, 13-year-olds are prone to getting cervical cancer. Now, from your explanation, that HPV virus can take a while in your body before you can start to see,
That's true.
you know, the signs and the symptoms. So what is the way forward?
First, I want to inform the viewers that we have the vaccines in the facilities, at all health centers, mainly government, and even some private health facilities that have offered partnership with the Ministry of Health to provide immunization. So we have the vaccines at the points. And even as our health workers reach out to community posts, please endeavor to take your child, your daughter, and even children for the underage, for the under 1 vaccinations with their cards to their respective service points. There they will receive a comprehensive package of services, vaccination, deworming. They will also receive vitamin A. Depending on what age you are, you will definitely get a package during this period of integrated child health days. And then I also want to encourage us that with the immunization is actually a multi-stakeholder commitment. It requires multi-stakeholder commitment. We want the school, Ministry of Education to also join hands with us because we also get challenges in accessing the schools. Private schools say you have to get consent from the teacher, and yet we have the immunization policy, which is also taking us, you know. So we get challenges. So it's a multi-stakeholder kind of engagement that we have to go through as parents, advocacy teams, and everybody.
Yeah. There's another question that comes to mind. So
Yes.
if I am of this age, I cannot go for, I'm not eligible for the vaccination?
No.
No.
Immunization?
You are.
Am I?
You are. Indeed, the package in Integrated Child Health Days, she's eligible for TD vaccination if she has not finished.
But not I think asking the council service.
Okay, that's
Yes.
another debate.
Yeah.
Mr. Mwezi, in your
Yes.
closing marks, I have 1 minute.
But
Yeah.
for cancer of the cervix, you
Yeah.
are not eligible.
Okay.
Yours is to go for screening and regular screening and arrest the disease.
Unless you can prove you are a virgin.
Yeah,
That one.
that one is a good one also.
Yes,
We shall
yes.
need the labs for that. Mr. Mwezi, in a minute.
Yes, my closing remarks are really two. One is to re-emphasize what my colleagues have said about coordination. We certainly have seen that coordination really works. We are actually actively pushing as civil society to have an interministerial engagement around issues of vaccination. We are already seeing bits of it at the lower local government levels. For example, schools at lower local government levels are very receptive to vaccinations drives. And more so in the integrated child health days. Someone asked me, why do you say days? Because it's a whole month. So just to clarify, it's the entire month of April and the entire month of October.
Okay.
Maybe my colleagues will change it to integrated child health month. Yes. Then my last bit is really a call to action. Cervical cancer, for those who know or those who have suffered it, is not a very, very pleasant experience. And you really want to take on any opportunity that prevents or protects you against cervical cancer. And so for the mothers and fathers out there raising girls, please, please, please prioritize getting your child vaccinated. as we also look at how we can get the vaccination approved for the boy child as well.
Okay.
Yes.
Well, thank you so much, Mr. Muhwezi Alvin, who is the head of programs with Impact. Also, Sister Emily, thank you so much, Principal Nurse at the Ministry of Health, and of course, Honorable Member of Parliament, but Doctor in your capacity also, Kamara. Thank you so much for that input and the legislation side backup. It's very, very important. Now, we come to the end of this program, but just to bring it back home, that at my age, I can no longer get the immunization of cervix cancer. Now, that means that I'm prone to getting cervix cancer and probably suffering, the issues with it. It's treatable, but for the parents that have your children, please take this information very, very gravely to save the future of your child. And for the drives, the immunization drives, please get that information and get your child immunized against the cancer of cervix and other diseases. It's a holistic thing that we're talking about here, because if you don't have a healthy child, then we don't have a healthy population, then we won't have a healthy future for the country of Uganda. So it is a collective, integrated effort. Much as government is pulling their part, civil society is pulling their part, even us as a population, we must pull our hands and efforts together. Thank you so much for having been a part of this discussion. We trust that it has given you enlightenment and a way forward in your decision making regarding health. Good day.